some of you would probably know me because I grew up in the Valley and I'm an orthopedic surgeon specialized in hip and knee replacement and also sports surgery. And I operate a lot of guys in the Valley. But today we are not here to speak about me because it's not the most interesting, but to speak how you have changed my habits on my surgical practice. So I guess that some of you are asking ourselves, what is an arthroplasty? An arthroplasty is when you replace a destroyed joint by an artificial one, which is made by metal, plastic, or ceramic. So why are the patients different in Chamonix? It's because you have seen Chamonix is a valley with high tops, and sports is a way of life. And a lot of people practice sports, and very strenuous sports, and they have more risk of wear and tear on their joints, and we have to operate them after that. So we have to deal first with sport professionals, like skiers, runners, climbers, but we have also to deal with mountain guides and ski instructors. And for them, the problem is different. They are not only practicing sport for pleasure, but also it's their job, and they have to continue it until they are retired. So it's for us a real challenge to be able to do that. But what is also interesting in Chamonix, there are the sports amateurs. Because for the sports amateurs, sports is also very competitive. And you probably know that in Chamonix, you don't have your place because of your job, because of the money you earn, because you have your place because of the place you had at the last run, ski run, or race the weekend before the week. And if you are not an high-level sports amateur, you are not very well in Chamonix. So that's why we need to help you to go back to these activities. So that's why the patient expectations are a bit different. Because when you go everywhere in the world, when you operate someone for a hip replacement or hip arthroplasty, the goal will be a good functional result in daily activities. They want to be able to walk, to up and down stairs, and to do the arm work, but not more. In Chamonix, it's different. The patients want no limitations during their sport activities. And as they want to go soon to their activities, they also want a fast and easy recovery. And as they don't want to stop their sports too early, they also want to have good long-term results. So you see, when you are a surgeon, you have to deal with that. So you will see, but it's crazy. How can we perform sports with an arthroplasty, with metal and plastic in the hip or in the knee? And we have made a study to assess that with more than 1,000 patients. And we try to see how they were motivated for sports after an arthroplasty, and in this case, it was an hip arthroplasty. And we can separate the slide in three parts. On the left, you have the very low sports, like swimming, fishing, playing golf. In the middle, you have the moderate sport, like dancing, hiking, hunting. And on the right, you have the very strenuous sports, like skiing, running, or playing tennis. And you see that lot of patients practice very light or moderate activities, but nearly 30% of patients are motivated for strenuous sports. So it's not just a philosophical question, it's also a reality for a surgeon every day. But at least, do they return to their sport activity? Yes. And you see that the repartition is very homogeneous. So we have a patient with light and moderate activity, but a lot with strenuous activities after the arthroplasty. So when a patient comes to visit you and ask, what will I be able to do after my surgery? You can say, you will be able to practice all sports, but it will depend on your motivations, your prior level experience, and for how long you have stopped to practice this sport. For sure, if you have stopped practicing skiing for more than 10 years, after the arthroplasty, you won't be able to come on skiing. But if you have just stopped for 1 year, it will be easier to come back. But when we speak about arthroplasties and sport, we have to take account about the risks. Because you know that there is a lot of energy when you practice sports, and you have more risk of breakage of the prosthesis itself. You can have fractures around the prosthesis, and you have more risk of dislocation for the hip and the knee. And you have to inform your patient about this risk because it's very important. And you have also to educate them, to help them to go back to their activities the safer as you can. So why my medical experience has changed? So I made my study in Lyon, not so far from here, and I work in Annecy, another city of crazy guys, not for 10 years now. And I had to change because at the beginning I was the same surgeon than the others. I said to my patient, you should stop sports after your arthroplasty. And one day I was in the lift at the Grand Monte and I saw one of my patients just 6 months after the arthroplasty. And from this day I said, so if you want to practice sport, you will. So it's maybe better to help you and to follow you than you let it do it by yourself. So from this day I changed my habits and I began also to work in research and development for the prosthesis itself. Because we have to understand what are the problems in the prostheses themselves. And I also work for the UTMB Ultra Trail du Mont Blanc Health Commission. And it's very interesting for me because I have the experience of very strenuous sports and the consequences on the joint on the global person. So you probably say, oh, but hip and knee arthroplasty is not for me, it's for my neighbor. But you see that just for me per year is around 250 arthroplasty. So I think that maybe 10 or 15% in this room will have an arthroplasty one day. And I also perform some arthroscopy and ACL reconstruction, and it's very interesting to practice all the surgery, not only a kind of surgery, because we can have a continuity with the patient from the first trauma to the arthroplasty. So we really know the patient and we can help them, it's easier. And I also a bit of sport experience, so don't try to find my name in the top of the ranks, but maybe at the last. But I try to be in the race, and I think it's very interesting for me to share during training, during the race, the difficulty and to understand what really the sport practicing is. But to practice sport with an arthroplasty is not just a question of surgery. It's in fact a long process, and we need to have some partners to be able to achieve this long process. And it begins from the surgical indication, the first time you see the patient, to the best level of activity. And you see that the surgery is just a point in the long way. The first step is a very clear information of what the patient will be able to do after the arthroplasty. If you have a patient who say, oh, I was able to walk 5 hours, and now I walk only 2 hours, I want to be operated, it's not a good indication. But if the patient say, I daily pain, I cannot do what I did before, it's a good indication. And you have to be clear about the risks because they are a reality. Then, after that, we try to create some groups of patients because we think it's better not to be alone, but to be with your friends, like when you prepare a race or something like that. And we have a first pre-op meeting with a nurse, with anesthesiologist, surgeon, and physiotherapist, and we clearly prepare the post-operative management, and we explain to the patient what the surgery is. Because when you understand what will happen when we go behind the door with its written operative room, it's easier for you to understand and it's more clear. So, as I said, for us, create groups is very interesting from the beginning, and then for the rehabilitation, and then we go back to sports. We can really create a group of friends, and we can create an emulation at each step. What is the first step of the rehabilitation? You know, when you have been operated, you are afraid. You say, oh, what will happen? Can I move? Can I walk? So you have to explain to the patient that he can, there is no problem, and if it breaks, it's better if it breaks the day of the surgery than 2 months after, because if it breaks 2 months after, you have lost 2 months. So that's why we explain them not losing the automatism. So they are operating the day of the morning of the surgery. On the afternoon, they stand up and they begin to walk with crutches. And we say them to move their leg. And just they have to keep in mind the pain. But we also treat the pain, because if you don't have pain when you wake up, after you won't have more pain. Because when you wake up, the first thing you are searching is, where do I have pain? I've been operated, my scare. If you just treat the pain and you move, you say, oh, it's not so bad, I can go on. So the treatment of pain is really important. And we don't consider the patient as patient, but as sport guy. And we say, oh, we are going to do an early sport rehabilitation, and we are not focused on the joint who had been operated. We try to make a global job on a global movement. Because if you just consider the knee, the patient will walk. And the problem is not the knee, it's the hip. Because if you move your hip, you have the feeling that the knee has nothing to do. So you have to explain to the patient the global movement. And when doing that, it's easier. And we try to make the rehabilitation like a game. And it must be funny. You should try some flag lines, some and when you are a sport guy and say, you have a challenge to do, you know that he will be able to do that, because it's habitual for him to go to do some challenges. Then, rehab had been done. We go back to previous sport activities. So at this time, we like to have group progression. And we work with my friend Stéphane Balma, who is in the audience. He's a ski instructor and also physiotherapist. And he has a nice view of the pedagogy on how to do the movement when you have been operated. And I think it's very interesting. And when you are in group, the patient can share their fear and their experience, and they can progress together. But sometimes we have also to practice individual and specific training. So this is why the guy was operated after 6 months for a THR. So he wanted to be able to run when he went down. And for this guy, so he took a little bit of weight, but it was his first race, and it was 4 months after the surgery. It was a trail around 13 kilometers. So going back to sports activities after arthroplasty is not only a dream, it's for us a reality, and we have to deal with that every day. And it's also very interesting for us, because it's also a challenge. And when you are getting old and you are not able to have good results in sports, you try to have it in surgery. And I hope we are breaking new ground in speed of recovery. So we have changed a lot of things, and the patient has also changed their mind. And I hope we'll be able to influence medical practices in other parts of the world. Thank you.